Hi, Dr. Harrison here, and today I want to talk about a very important topic. It's one of the most common conditions that I see in my office, and that is neck pain. If you're watching this video, you may be suffering with neck pain, possibly numbness or tingling into the arms, maybe radiating pain down into the arms or into the shoulders. This is all very typical with some of the patients that I see suffering with neck pain. So today I just want to explain a little bit about the most common causes of neck pain and how we go about treating those and identifying those in the office. So number one, the most common cause of neck pain that we see is tight muscles and restricted mobility. So of course we're going to do a thorough examination. We're going to check the range of motion, run through some orthopedic tests to make sure there's nothing more serious going on, and then usually we'll take an x-ray. Well, if your problem is just tight muscles and restricted mobility, on the x-ray, everything's going to look pretty normal. On the front view, everything will be lined up properly. On the side view, you'll have the normal curvature. It's normal to have an arch in your neck when we look at the side view or lateral view. And so everything would look completely normal. And once we've ruled out anything more dangerous, then we know we're dealing with tight muscles and restricted mobility. The second most common cause, along with the tight muscles and restricted mobility, we might get a shift in the structure. That's what we call a static subluxation. Maybe the bone is tilted or it's rotated out of its normal position. So on the x-ray we would see that. Maybe the bone is rotated to the left or right, or maybe one or more of the vertebrae is tilted and we'll see it laterally flexed or shifted on the x-ray. Those are a little bit more difficult to treat because now we're not just focused on getting mobility back into the joint, but now we have to get in there and try to realign that structure and have that bone reassume its more normal anatomic position. So that can take a little bit longer to fix. That's the second most common thing that we see in the office. The third most common would be arthritic change. On the x-ray we might see bone spurs, calcium deposits. We might see that the disc spaces in between the bones have started to deteriorate, either due to an old injury many times, maybe they've got a disc herniation or a disc bulge where that disc is just starting to deteriorate. These are all signs or beginnings of arthritic change in the spine. So we're really focused on maintaining or regaining mobility that's been lost in those situations, which will help slow down the progression of that arthritic change. Along with that, we may get the first and second most common things, tight muscles, restricted mobility, sometimes a shifting in the position of the vertebrae. So sometimes in that third possibility category of arthritis, we might see all three things going on. And then the fourth and probably the most serious thing that we would see with regards to neck pain, and this is the one that a lot of times is accompanied by arm pain or numbness and tingling in the arms, and that would be a disc herniation. A lot of people are of the misunderstanding that if you have a disc herniation that you're not a good candidate for chiropractic care, but that's just not the fact of the case. We have a lot of patients that I've seen over the last 20 years that respond beautifully to chiropractic adjustments and conservative therapies like muscle stimulation, ice, heat, ultrasound, those types of modalities, and they recover and do very, very well with chiropractic care. Of course, if they're not responding, they have a very serious disc problem. There are other options, spinal decompression, which I discuss on another video, or possibly as a last resort, surgical intervention, and we work with orthopedics in town that we can refer you to. So if you're suffering with neck pain, please don't hesitate to pick up the phone. There's no need to needlessly suffer. Call the office, schedule a free consultation. We'll see what we can do to help you, help identify which of those categories you're in, and put a treatment plan together to get you back on your way to health. I hope this video has been informational and you found it useful, and I look forward to speaking with you soon in the office.